Good afternoon, everyone, and welcome to my Friday message. This past couple of weeks, I've spent a good amount of time welcoming our newest health profession students. I've traveled to the various orientations and convocations, and I've realized why I feel so invigorated this time of year. It gives me hope, inspiration, and optimism, knowing that the future of medicine and biomedical sciences is in great hands. I'm not just talking about our 121 MD students. I'm thinking of the 44 occupational therapy and 102 physical therapy candidates, the 91 physician assistants to be, the 45 new colleagues earning their Masters of Biomedical Sciences, the 123 PhD candidates in 17 programs, and the students obtaining masters in an increasing number of programs, everything from biostatistics to clinical research. And of course, 1,500 residents across our primary care and subspecialty training programs. We are all united in the mission of advancing health together. And we are uniquely fortunate as a community and as a profession to have this yearly infusion of remarkable talent and passion. I would encourage everyone to take the time and welcome these new members to our community and to recommit to our role as educators, mentors, coaches, and colleagues. Now for our updates. Let's begin with COVID. The level of COVID infection across the United States continues to be significant, but we are seeing a downward trend. According to the CDC, 40% of counties, territories, and districts, including Durham, have a high community infection level, but that's down from the last time I reported. Last week, the CDC streamlined some of its guidelines. The new guidelines continue to stress the importance of being up to date on vaccines, which now includes boosters where appropriate. I continue to encourage all to complete their recommended vaccinations as the vaccines continue to protect against morbidity and mortality. One of the main changes in the updated guidelines address those who have not been vaccinated but exposed to COVID. Rather than quarantining, as previously recommended, it is now recommended that those individuals wear a high-quality mask for 10 days and get tested on day 5, similar to the recommendations for those vaccinated and exposed. They also reiterate that regardless of vaccination status, individuals should isolate from others when they have symptoms of COVID or have confirmed COVID. And when confirmed, stay isolated for at least 5 days and wear a high-quality mask for 10 days. Although the guidelines don't recommend testing to determine when one can discontinue isolation when you do have COVID, we now know that some infected individuals can shed virus beyond 5 days and a small number even beyond 10 days. And we also know that the antigen positivity does correlate with the presence of culturable virus. And therefore, repeat antigen testing with at least 2 negative tests provides additional layer of precaution, particularly if you're planning on being in close contact with those that are increased risk for disease with COVID. The guidelines for K-12 education have changed as well, and I would recommend visiting the CDC site for a complete list of the current recommendations. Here on campus, masks are still required for in-person classes, on Duke buses and shuttles, and in patient and clinical settings for all individuals, regardless of vaccination status. And I want to remind everyone that you should stay at home if you are not feeling well, particularly with symptoms consistent with COVID. What about boosters? A study published out of Israel and JAMA this month evaluated the efficacy of a 4th mRNA vaccine dose during the Omicron surge in preventing breakthrough COVID-19 in healthcare workers. Overall breakthrough infection was 7% in the 4-dose group and 20% in the 3-dose group, again, showing efficacy of a booster strategy. And in a recent editorial in Science by Eric Topol and Akiko Awasaki, they made the case for Operation Nasal Vaccine to rapidly evaluate candidate mucosal vaccines that might more effectively induce mucosal immunity to COVID. While RNA vaccines remain effective in preventing disease and death, they do not induce a robust immune response in the nasal mucosa. Such a response could more effectively block the rounds of infection which have been seen with the new variants. At least 12 candidate mucosal vaccines are in clinical development, and 4 have reached phase 3 randomized placebo-controlled trials, and we'll keep you posted when those results are available. And now to another outbreak we're tracking, monkeypox. As of August 16th, there are 180 cases in North Carolina out of about 12,600 nationally. The FDA has approved 2 vaccines that can prevent monkeypox. Given the high demand for these vaccines, the FDA now is seeking to stretch the supply, and they've authorized a change in how the Janus vaccine can be given. By changing from subcutaneous to intradermal administration, less vaccine volume is required per injection, thus increasing the number of vaccines that can be given. As a reminder, Duke has a website to share the latest information. To stay informed, please visit that website. With all this focus on infectious disease, an effective tool for detecting early spread of infectious diseases within communities has proven to be quite effective during COVID. Monitoring sewage. Monitoring wastewater data is helping scientists detect COVID variants in communities, as well as a number of other pathogens, even before the data from clinics and hospitals get reported to public health officials. As reported in the New York Times this week, programs like the Sewer Coronavirus Alert Network in California, as well as other communities participating in the wastewater scan, using this strategy to monitor other infectious diseases, such as monitoring monkeypox, generates real-time data for communities throughout the United States. Along those lines, you may have seen the news that polio has now been detected in 7 different wastewater samples in 2 adjacent counties north of New York City. So far, only 1 person has tested positive for polio, an unvaccinated adult who did suffer related paralysis. One last bit of national news. On Wednesday this week, the CDC announced a sweeping reorganization aimed at changing its culture to be faster and more responsive to responding to public health crises. Changes will include making it easier for other agencies to work with the CDC and removing conflicting or overlapping guidance from the agency's website. In the words of Rochelle Walensky, the CDC director, "My goal is a new public health action-oriented culture at CDC that emphasizes accountability, collaboration, communication, and timeliness. And I'll be sharing the proposed changes as we learn more about them." Now let's pivot from the national stage and return home for some more good news. Dr. Edward Patz, professor of radiology, pathology, and pharmacology and cell biology, recently received the Joseph W. Cullen Prevention and Early Detection Award from the International Association for the Study of Lung Cancer. Dr. Patz was honored for his lifetime achievement in the prevention of thoracic malignancies. And an international research team led by Joe Heitman, chair and professor in the Department of Molecular Genetics and Microbiology, has identified one of the ways that drug resistance can develop through gene jumping. And you can learn more of these discoveries on the School of Medicine site. Please join me in congratulating these outstanding scientists on this well-deserved recognition. And join me in welcoming our new students that I mentioned at the top of the message. The MD and PEA programs even have student-led Instagram accounts, and many of the orientation ceremonies have been captured in videos, so check them out. That's all for now. Stay safe. Thanks for all that you do, and have a great weekend.